Thank you, Mr. Chairman. SB 107 is our trans state of refuge bill, which will ensure that trans kids and their families, if they do not feel safe in their state because of criminalization of the families of trans children, they can come to California, and we will do whatever we can to keep them safe, and that we won't be a party to enforcing the despicable laws that we're seeing being passed in states like Texas, Alabama, and elsewhere. You may have seen that some of these states are passing laws basically providing that if a parent allows their trans child to receive gender-affirming health care, they will be the child will be that will be deemed child abuse. Child will be removed from the household and placed in foster care, and the parent will be prosecuted. In Alabama, the parents will be placed in state prison for 10 years simply for allowing their child to receive gender-affirming care. 10-year state prison sentence for parents. Also a 10-year state prison sentence for the physician who provides that gender-affirming care, which of course is completely within professional medical standards. So the bill provides that if those families leave because they do not feel safe, they can come to California, and we will not enforce that law, that they will be extradited only if the U.S. Constitution requires that they be extradited. If there's discretion for extradition, they will not be extradited, and that if they are, if subpoenas are issued from that state into California relating to this issue, those subpoenas will not be honored. This was a gut and amend in the Assembly, which I had to do because this started happening after the bill introduction deadline. It was like in March and April that these executive actions and laws started moving forward, so this was an emergency situation. I would have loved to use this bill vehicle for something else, but we have, I think, no choice here. These laws are absolutely disgusting, and it's time for California to stand firm in support for these families. I respectfully ask for your aye vote. With me today
move the bill.
Our co-sponsors, Tommy Martin with Equality California and Molly Robeson with Planned Parenthood.
Okay, and I'm going to ask the witnesses in support as well as the witnesses in opposition to limit the comments to about 2 minutes at most.
Good morning, Chair and committee members. Tommy Martin on behalf of Equality California, one of the proud co-sponsors of this bill. As Senator Wiener explained, of course, the goal is to protect people who may need to come to California, to protect them from the laws of other states that restrict gender-affirming care to the full extent that we can here in California. The bill also indicates to trans youth and their families that California welcomes them and that Californians continue to have the right to control their bodies and to live their lives authentically. Gender-affirming care is supported by and seen as evidence-based care by major medical bodies, and we know that supportive policies such as this one have a measurable positive impact on the physical and mental well-being of trans youth. Of course, not everyone who is in another state with restrictions will have the ability to leave their home state, and those who do may go to other states that are geographically closer. However, for those who do reach California in pursuit of an authentic life, we want to be sure that they're able to be protected in that endeavor. So thank you.
Hi, Molly Robeson with Planned Parenthood Affiliates of California. As other states enact hostile legislation criminalizing health care from abortion to gender-affirming care, California is, of course, taking the lead and taking necessary steps to protect access. Confidentiality and bodily autonomy are part of Planned Parenthood's mission, and our health centers are committed to providing accessible, inclusive, gender-affirming care to those who seek it. SB 107 ensures that we can continue to do so without our providers being in fear of another state's law interfering with their duty as a medical professional. For these reasons, we're proud to co-sponsor this bill and respectfully urge your support today.
Thank you. Department of Finance.
Thank you. We don't have an approved position on this bill. We do note that this bill has minor and absorbable fiscal impacts for the Department of Managed Healthcare, the California Department of Insurance, and the Department of Justice.
Thank you. We'll now turn to the public for public comment in support of SB 107.
Thank you. And Mr. Chair, we have no further support in queue at this time.
Okay, we'll bring it back to opposition. We have two witnesses who have identified themselves as opposition witnesses. One is Aaron Friday for Our Duty, and I believe Aaron is on the telephone line. And then we have Greg Burt, the family counsel, who is going to testify in opposition in the committee hearing room. So we have...
Actually, I'm Aaron Friday. I'm here in person.
Okay.
I'm Aaron Friday. I'm a licensed attorney and a mother of a formerly trans-identified child. Our Duty has met with most of your offices to express that parents are against SB 107, regardless of party affiliation. SB 107 is unconstitutional under the full faith and credit clause, as pointed out by your own analysis. It violates parental rights under the Constitution. Provided the child makes her way to California, this law obviates every custody agreement in the nation, not just in states that astutely bans gender interventions on minors. The UK's Tavistock Pediatric Gender Clinic just shut down because the science does not support transitioning minors. This law codifies kidnapping and offers protections to a non-custodial parent who absconds with the child to California in order to get gender interventions in contravention of an out-of-state order or the custodial parent's wishes. Even more terrifying, this law encourages minors to run away to their parents if their parents won't consent. It is foolhardy to think that kids are not being encouraged to run away. By way of example, Plume, an online hormone company, gleefully announced in June to a minor that, like California, runaway or homeless youth under the age of 18 can consent to their own hormone treatment. The financial analysis of this bill completely misses the mark. If you think that only 5 custody cases a year will be filed at a total of less than $100,000, you are naive. Where is the cost to foster care? Where is the cost for the runaways, homeless services, and Medi-Cal? Every AG in this country should be lining up to file a lawsuit against California. What are the costs to minors? Sterility, missing body parts, loss of sexual function. The FDA last week warned of blindness and brain tumors from puberty blockers.
Ms. Friday?
There is no evidence that the...
Ms. Friday,
yes.
I don't mean to interrupt, but I indicated 2 minutes for each witness, and so your time is like seconds from that.
Okay. Understand that every aye vote or abstention means that you are a proponent of sterilizing or experimenting on minors. Parents don't forgive harms to their children.
The other individual that had indicated being a witness in opposition is Greg Burt. Is Greg Burt?
He was unable to attend, and so.
Okay, then we will then turn to.
Oh, wait a second. We have a witness though.
No, it's only on the one. It's Greg. It was you and Greg Burt as a witness. We'll take opposition. Are you Greg?
Yeah, I'm Greg Burt. Yeah.
Oh.
Is it possible this young woman
means.
could testify on my behalf? That'd be great.
I'm sorry.
Is it okay if this young lady would testify
No.
with my 2 minutes? Is that all right?
We're going to take your testimony, if you have it, as a witness. We will have everyone else have an opportunity to state their opposition, but name, organization, and their position on the bill.
We just didn't get our change in quick enough. I'm sorry about that. But I'll read her testimony. This is the testimony from this young lady right here. Is that right?
Yes.
Okay. I'm a former Democrat who left the Democratic Party because of gender ideology. I'm a parent of a teenage detransitioner. At the insistence of the medical community, we regrettably placed our 12-year-old gender-confused daughter on puberty blockers. We were not told of long-term effects. Medical providers used the threat of suicide to pressure us to accept our daughter as our son. Instead of the promised relief and stability with both social and medical transition, our daughter's mental health grew worse. She was more suicidal, engaged in cutting. Her sleep, her eating habits became abnormal. Our days were crisis management. Reverse course pulled her from public school that was pushing this gender identity and found an out-of-state psychiatrist who, with Family love and compassion brought our daughter back. We were investigated by CPS when the daughter's detransitioning started. Imagine losing your child because you believe in biological facts. My daughter is now a happy in her female body, but I will never forgive myself for subjecting my child to what may result in long-term health problems. Only time will tell what puberty blockers did. Senator Wiener knows that parents are up in arms about what is being taught in public schools, yet he recently made a joke.
Excuse me. We are not going to make any personal attacks against or references to the member. You can make your comments in general, and I appreciate that, but no personal comments back.
Okay. He pushed for an emergent state of monkeypox and then retweeted advice for those who want to continue having fun while enjoying the kink and fetish in San Francisco. He referenced, okay.
Yeah, and I think that your time, you've got just a second to
I'll just do the last little paragraph right here. We parents don't trust him to promote laws that are in the best interest of our children, and you shouldn't either. Are there any Democrats who have a backbone to stand up to this idol?
Thank you. That your time has expired. So I appreciate your. We're going to turn to opposition in the committee hearing room at this time, and that will just be for Ms. Burt. You're through. Thank you. Your time has expired. We're moving
Greg
on
Burt
to
from the California Family Council in opposition.
Thank you.
I'm Kristen Brown. I'm a parent of a trans-identifying child, and I'm a registered Democrat. I oppose this bill.
Hello, Stephanie Dagry with Take a Stand Stanislaus, San Joaquin Liberty Coalition, and Nurses for Medical Freedom. I'm a licensed registered nurse, and we oppose this bill. Thank you.
Thank you. Is there anyone else in the committee hearing room that would like to register their opposition to SB 107? Seeing none, we'll move to the phone lines.
Thank you. And Mr. Chair, we have no further opposition in queue at this time.
Okay, thank you. We'll bring it back to the committee, see if there are any questions or comments. Dr. Quirk?
Could you address some of the issues brought up by the opposition, non-custodial parent kidnapping a child running away? How would those cases be treated? And anything you can say medically about delaying puberty, which is often well, I don't know about often, but is one of the ways of giving the child a chance to make a further decision.
Well, the purpose of puberty delayers is it does create more space before other decisions are made. But just to be clear, with I think with one exception, we're not physicians, we're lawmakers. The medical profession is very clear. This kind of treatment, it falls within accepted medical standards. If it doesn't, the doctor does something they're not supposed to do, they're subject to discipline. But the attack on gender-affirming care is people are entitled to their view, but this is accepted medical practice under the supervision of a physician. In terms of extradition, the bill is very clear that extradition is prohibited unless it is required by the U.S. Constitution. The required extraditions are when there is a fugitive. Someone commits a crime in state A and then goes to state B. This whole notion of this being of the kidnapping, I think that is a wild exaggeration. These are families that are literally fleeing the possibility of being put in prison for 10 years, parents being put in prison for 10 years because they allowed their child to have health care. So for anyone saying this takes away parental rights, that is a completely frivolous, made-up argument. We're protecting these families literally from states that are saying, if you parent make a decision about your kid's health care, you're going to prison. That's what this is about. But if there is someone who is a fugitive, commits a crime in one state and then comes to California, that counts as a fugitive extradition. And that, as I understand it, the U.S. Constitution requires that California extradite. So the bill is clear that whatever the U.S. Constitution requires for extradition, we're not going to contradict that because that's the U.S. Constitution. And so, you know, I think again that kidnapping argument is very exaggerated to say the least.
Yeah, just to be clear, we can only refuse extradition under the circumstance that what the other state is doing is not prohibited in California. Kidnapping is prohibited; you would have to extradite.
And if it's
and also we have certain provisions for runaway children that would also be recognized in California.
Yes,
and so the case you're dealing with, and the only case you're allowed to deal with, is where there is parental consent and for a treatment which is legal in California but illegal in the other state.
Thank you. Any other questions? Oh, Davies.
Thank you. One question is, if they do come over to California, who would be paying for that surgery?
This is if parents. First of all, this situation you could have several situations. So parents who are, let's say, living in Alabama and have allowed their child to receive gender-affirming care, and who do not want to lose custody of the child and go to prison for 10 years, they can come to California, and we will do, to the extent permitted by the Constitution, we will give them refuge. If a parent decides that they're going to move to California or come to California to obtain health care for their child because it's illegal in their state, that would be paid for however they would typically pay for it, whether it's with health insurance or out of pocket in situations when people pay out of pocket. This does not deal with who pays for health care. Health care is paid for in whatever way it is currently paid for. Private health care, out of pocket, Medi-Cal, whatever the case may be. This is simply saying that we're not going to be a party to enforcing these despicable laws from other states.
So I just have a question. I understand that this is something where you are protecting the parent's right to make these decisions. What about protecting the parent's right not to have their kid vaccinated? I'm just a little confused on, when you do something like that, pick and choose which right they have and which right they don't have. That's just my confusion there.
I'd be happy to debate that vaccine bill for teenagers with you. I don't think that bill's before the committee, but I certainly stand by that bill.
Yep. Ms. Wilson?
Thank you, Senator Wiener. Thank you for bringing this bill forward. Proud to be a principal co-author on the Assembly side. As a mother of a trans-identified youth, this is extremely important to the families. And there are horror stories across our nation of families who've gone through this process and at the same time had different outcomes. But I think at this point, we have to find a way to protect people and make for the most successful outcome. You can always have a story of an exception where it didn't work out in regard to whatever mental health care was provided for a child or a child processing through emotions related to gender confusion. But at the end of the day, we have to make sure that we're protecting our youth and we're allowing them to grow into the healthy human beings they're supposed to be and the healthy adults that they're supposed to be and giving them the best possible outcome. And what I love about this bill, it's not just about making sure the kids in California have the best possible outcome. It's the kids across our great nation, even when they're in states that don't protect them in this way. So I appreciate you for bringing it forward. I appreciate your courage because I know you do a lot of big things and people attack you a lot for that. But I just wanted to know, I wanted everyone in this room to know how important this is. And it really does protect our youth and protect our parents across this nation. And California continues to lead the way. And not only are we leading the way on this subject, we are a place of refuge, and that is really important. So I respectfully ask for my fellow committee to support this bill.
Dr. Weber?
Good morning, making sure it's still morning. I just want to make sure it's very clear, and Assemblymember Quirk did an excellent job of kind of outlining it, but I think you used a lot of legal terms. So based on what we've heard from the opposition, does this bill allow for a child to leave his or her state and come here for treatment, or have someone take them who's not their parent or legal guardian and bring them here to California?
No, if someone is being kidnapped as defined by the state, then we would, to the extent required by federal law, have to honor that, and that would be a legal issue for a court where an extradition warrant is being sought. In terms of a child who comes here, who runs away from home, it would just depend on the facts of that case, and that's a very broad spectrum, because you can have situations where a minor might be effectively emancipated or whatever. So that would really be very fact dependent.
Okay. All right. Thank you so much for introducing this bill. I do have a couple other questions I'll ask you offline.
Thank you.
This is not the place to discuss the differences between vaccines and this particular bill. However, it was brought up by a member of this committee, and I want everyone to understand that there is a difference when you're talking about vaccines. You're talking about public health, because what one person does impact the health of another. However, when you're talking about gender-affirming care, abortion, it has to do with that particular person's individual body. So there is a difference on how it impacts the rest of public health in general. But thank you very much for bringing this up.
Thank you, Senator. Seeing no other comments from the committee, I too appreciate your leadership in stepping into areas of necessity where people are impacted that need to have a champion and someone who's paying attention to their unique needs and concerns. And so I salute you in terms of not just on this bill, but just your consistent effort to try to make sure that those who are marginalized are certainly brought to a place of equity and fairness and balance for them in their personal life, but also in the community in which they congregate. So this bill is certainly one that we support. I support. It enjoys a due pass. We'll give you an opportunity to close, and appreciate your patience as we made our way through this part of the process.
Thank you, Mr. Chairman. I just want to note, and this is also apropos of my colloquy with Member Davies, all this discussion of parental rights and the notion that this bill somehow removes parental rights, when frankly it's the exact opposite. It's states like Texas and Alabama that are trying to remove the ability of parents to authorize health care for their children. But I will say that in the state of Idaho did not pass this law. And you know why? The Idaho House passed it, and then when it went to the Senate, Idaho Senate Republicans killed it because in their view it violated parental rights. That has not been the prevailing view among Republicans in other states that have been passing this law, but I do want to just give credit to those members of the Idaho Senate for at least taking that perspective. So colleagues, I appreciate the dialogue today, and I respectfully ask for an aye vote.
Thank you. This is out on a B roll call.
Thank you.